one, I want to let you know my presentation's not that long. Number two, we do a lot of talking and interacting, okay? So everybody can put it in their heads. I may point to you, may call on you. All right. First, I want to take a moment for all of us to breathe. If you could go ahead and close your eyes. And we're going to go ahead and we're going to start that breathing. I want you to breathe in deep and breathe out. Just for a moment, enjoy the silence. Focus on your breath. I want you to release everything with every exhale. Bring in peace, joy, alignment as you inhale. Our clients, participants, patients are going to be fine this weekend. All right. It's 1 minute and 5 seconds. Seems like a long time sometimes. Sometimes it's too short. That 1 minute and 5 seconds, someone just developed Alzheimer's. Every 1 minute and 5 seconds, there's a wife that says, my husband's a little off. There's a caregiver that just learned of the diagnosis and is panicking. There are social workers advocating because we know Mrs. Smith is going through a cognitive decline. There are nurses fighting with their patient because they don't want to take their medicine. Every 1 minute and 5 seconds. We took that moment to breathe and decompress, and someone's life changed, just like that. We're going to run through the contents of health literacy and dementia. And really, we're going to get back to the basics of we care because you care. We're going to get a brief history, some characteristics, patient safety and outcomes, and then we're going to discuss some improvement. I can tell you now that while I'm going to the next slide, you can go ahead and open up to Appendix A in your book because we're going to look at that list. But let's get to the history. Right now, health literacy and all these fabulous terms, patient-centered care, all of this is going around in our prospective areas of expertise. But we don't know where it came from. Most of us went to classes, we got our degrees, we get to our job, and then all of a sudden there's an email, a conference, a phone call, a meeting. We got to make sure everyone is health literate. We got to make sure that we have patient-centered care. But it has been around since 1974. 1974, India had a movement. And that movement was the National Literacy Movement. That is the first time health literacy was penned, and it was penned because of Gandhi. When they talked about it, the first definition that came up was health education meeting minimum standards for all school grade levels. And now it has grown up and has infiltrated all aspects of life. These were the 4 reasons that shaped our understanding of what health literacy was. First, of course, the learning outcome in school-based education, literacy teaching tool and basic education program. It's a target dimension for the analysis of physician and patient interactions, a health promotion paradigm for decision-making processes. That's what we're supposed to do, but as we all know, we don't like to say all these words together and all these steps because we're busy. Our patients and clients and participants make sure that we're busy, our loved ones. So we did this one nice little definition. What's health literacy? The ability to find, understand, and apply health information and services to improve decisions made for the caregiver and the care receiver. We like that. And then we even make it even shorter. In health literacy, we want to make sure they understand. These are the influencing factors. Now that first one, age. Can someone tell me, when you think of age as an influencing factor of health literacy, what is the age that you think about? What's the first age? And you could just shout it out. For any health literacy. Like when you think of when health literacy becomes important, what age do you think of?
65.
65, 80? 18, 1 year. As soon as you learn to walk, talk, and understand language, you should know health literacy. Most of us that are parents, or if we've had little cousins, or the neighborhood kids, or we may have worked in a school, what is the first thing that you do when you see a child with a runny nose? Come here, let me wipe your nose. Come here. Come on. Let me get that nose. Wait a minute.
Yeah. Yeah.
And what does that child do when you want to get their nose? But do we understand why? Because they don't understand the concept that you're going to clean their nose without taking it off their face, and are they going to get it back? All they know is, let me get that nose. There's an old saying, once an adult, twice a child. Now you're 2 years old and you're running because you're going to take my nose. You're now 85 with dementia. I'm running because you're going to take my nose. That is why it's number one, because this is a life learning process when it comes to health and the way we are literate. Language barriers and proficiency. If you are not in an English-speaking country, and English is your first language, I can say to you, supercalifragilisticexpialidocious, and you will look at me and say, what? If I give you a diagnosis and say that you have idiopathic intracranial hypertension, most of you wouldn't know what I was talking about. That language barrier and proficiency, if I cannot break those things down into what I was really saying was, one, I wanted you to walk down the hallway so I can see your steps. Supercalifragilisticexpialidocious. Even though we use the word gait, most people don't know what that means unless you're talking about the gait of a fence. IIH. Idiopathic intracranial hypertension. Most people will not hear that. The other one is pseudotumor cerebri. Most people will not hear that unless you have it or know someone that has it. To break it down in simple terms, your body is overproducing spinal and brain fluid, and it is crushing your brain like a tumor. Y'all understood that, right? Chronic conditions. If I have hypertension, diabetes, if I have a heart condition, and I broke my leg, but you come in here and you tell me that you are going to give me this intervention and it first starts with magnesium in a bag and I'm going to give you these fluids, what are you treating? Education level. Now, like I told the last group, education level, they always say if you have a lower education level, health literacy is something that is hard to understand. But I beg to differ. I have several degrees. I have a few titles in front of my names, lots of letters at the end. When I got a phone call that my mother had succumbed to COVID, this is what I heard. Supercalifragilisticexpialidocious. Where is my master's? Where is my seminary teaching? Where was my second grade education? So imagine if you tell someone during that 1 minute and 5 seconds they have Alzheimer's dementia or a related dementia. What are they hearing after that? Socioeconomic status. We all know the more money you have, it's supposed to be the higher your care. The less money you have, the lower you care. Well, I found out today Hamilton County is one of the richest counties in Maryland. I also found out today, is this Hamilton, whatever county? Howard? Okay, Howard. Okay, wherever we are, see? Yeah, I'm sorry, Hamilton is one of our richest in Ohio. So y'all bring me back, say, hey, we're in Maryland, we're in Maryland. Okay, so Howard County, one of the richest. I was told today there was an 85-year-old that had a medical issue and laid in the ER hallway on a gurney for 2 days. So socioeconomic status, yeah, it still plays a part on some of your care, but if the healthcare system is crashing and no one knows if anyone came to explain things to her while she laid in that hallway. Let's go over some characteristics what a health literate person and their team looks like. First thing is patient-centered care. We all see those wonderful colored strands there. That's how we are supposed to work together. It should center around you and your family. In this case, the professionals and their families. It should be meaningful and valuable. You cannot walk into someone and say, hey, guess what? You got cancer. Here, read this. Yeah. Yeah. You stubbed your toe. I'm going to cut it off, though. Here, read that. Somebody come over here and prep him for surgery. For what? Don't worry about it. You're getting surgery today, okay? We got to respect values and beliefs, preferences and needs. This is very important because with Alzheimer's dementia, there's a conversation that we all tend to forget that comes with it. When people find out about it, the first thing they do is the end. Not where we at. It could be the beginning of dementia, the middle of dementia. They are already at the end. So end of life is going to come with this. We have to understand, though, there are people that are still going to want a full code for their 85-year-old mom. Even though 200 pounds of pressure on a rib cage does not sound great, broken ribs, possible punctured lung, they don't care. We do not want a DNR-CCA. No matter how we explain to them, sweetheart, look at this. Do you really want that? We have to respect that. We have to respect that preference. We have to respect the continuing values and preferences of a dementia patient that you have walked into the room and 2 minutes later they told you that their value has just changed. If they say to you, I want communion every day, you go get communion, you come back and they look at you and say, why are you giving me that? Because you said you wanted communion, but okay. And you turn around, where are you going? Where are you going? Aren't you my social worker? Don't you have my communion? We still got to respect that. Informing. How informing are we? Even when it breaks our heart. Some of the hardest conversations we have to have with our patients is the trajectory of an illness. They want to tell you, it's not the illness, it's the medication. I know it's the medication. We still have to be informing to let them know they're coming towards the end of life. No, they're not going to know who you are. They're not eating because they can't remember to swallow. Make sure the patient is involved as well as the family. Make sure it's a partnership. That partnership actually goes a long way. Because not only do we partner with the patient, remember, it's centered care. So we should have an IDT or IDG behind us, interdisciplinary teams or groups. That's where our fellow co-workers, our bosses, the state, the federal government, all these wonderful people come in, because we should partner with them because they're going to help us with the bottom part, and that's accessibility. And everyone should be supportive of one another. Communication, that's a big thing. I think I communicate pretty well. I stand up straight. My mother used to tell me, get that back up. I didn't understand it because as a kid, we don't care. We're like, why are they messing with us? But now that I do a lot of conferences and I preach, I teach, and all these wonderful things, I understand why you got to stand up straight. You need these diaphragm muscles. Why? Because I got to create a safe and respectful environment. How do I do that? Easy to understand speech and language. Another thing that we have to understand with our speech and language is this, that the people that we deal with are hard of hearing. So our voices have to elevate, and we speak a little slower, but not that we sound condescending. So if you're doing this, before you go see someone, just remember to do that, to get some more air. Make sure your conversation is engaging. And that really means that sometimes you have to be where that person is. So if you have a client, participant, patient, whatever your name is for the centered person, and their family, but your centered person says, oh, we're in the Bahamas today. Guess what? You are now on vacation in the Bahamas with your centered person. And you're going to engage where they understand while they're in the tropics. If you have to go into the community and visit people at home, if you are with a client and the caregiver is now exasperated because Johnny doesn't believe he's home, guess what? We're going to engage Johnny, and well, come on, let's take a walk with me. I'll get you home. Usually if you walk down the hallway, walk around the dining room table while you're talking to them and walking back to the same place, they are home. Redirect them. And while you're doing that, make sure that the caregiver is walking with you and you can conversate with them and say, so the next thing that you know, you're going to notice they may steal food or they may hide money. They may want to fight you. Johnny, where did you say you lived again? Well, we'll walk a couple more miles. 2 steps could be that mile. Confirm the understanding with everyone. The demented patient may say to you, I understand that the cat got out the window. Okay. Make sure the caregiver understands whatever the care plan is. Make sure that the communication, these are our common terms, supplements, infection, eligible. But make sure that you break it down, modify some of these terms, because again, once your brain gets overwhelmed, your understanding begins and comprehension slowly drops. So if you have to bring it down to a 5th to 7th grade level, do that. Because you want everyone to be on the same page. Because one of the things that we don't like, especially myself as a geriatric social worker, I don't like people to do the rotating door of hospitals. That means paperwork for me. That means lots more meetings. That means that I possibly have to talk to the family about, can you take care of your parent? That conversation is never easy because they automatically think that you're telling them that they're bad. And be empathetic. And it's different from sympathetic. Be empathetic.
I was sick a lot. I was sick a lot because I probably missed dosage and didn't realize it. I was in the hospital a lot. When they did give me medicine, I didn't take it right. I admit to it. I just didn't understand them, and I didn't have the nerve to ask them the right way of doing it. I just didn't have the nerve to ask them, and I didn't want anyone to know I couldn't read.
I can't read this. Well, I guess doctor gave it to me, so it's okay for me to take it.
When your children have fever, what do you usually give them?
Motrin or Tylenol. Normally Motrin because that's what my doctor recommended.
How old is your daughter?
She is 4.
She's 4. Okay.
I would give her the 4 to 5, a tablespoon and a half.
One capsule.
That's right. One capsule.
One capsule. I don't know what this is. That
Twice?
Twice daily.
Okay. So how would you take this?
When I see it's not on, I tell you how to take it. It say take it twice daily, but it don't say what time to take it.
Do you know what hypertension means, if I asked you what that was? Because when I look at this, I think, well, maybe you have hypertension, and I've been taking care of that for a long time.
Hypered? Hypered?
Like you're hyper? What does being hyper mean to you?
That's where you can't be still. You always got to be doing something.
Do you think I think you're hyper and have hypertension?
I don't know. That's what I consider it.
Okay.
It being, Okay.
But you know you have high blood pressure. Okay, but hypertension doesn't mean the same to you. So if I ask you if you have hypertension, you're going to just think I think you're jumping around on the chair or something like that, something different.
Just being hypered,
Okay. All right. Well, I haven't done a very good job teaching you what hypertension is, because I think you take that medicine for your hypertension, and that's one of the things that I try to work with you on is your blood pressure. And high blood pressure and hypertension, to us, is the same thing.
The same thing.
Yeah.
I have a small breakfast, and then I take my pills. I usually take 16 every morning. Sometimes it's difficult to for me to take these pills because if they say 1 tablet twice daily, I don't know if they're talking take 1 in the morning, 1 in the evening, or take 1 in the afternoon or 1 in the evening. So usually what I do is take 2 of them in the morning. Then this way I know I have them.
If you have a reading problem, you go to the doctor. That can be very scary. It's like a nightmare. You walk in that office, and most people, if you realize the first thing you're going to have to do if that's your first visit is fill out a form. Your heart beats real fast. You're scared. You don't know what to do. You want to turn around and walk out. I have.
At approximately 30 or 31, I went into the gynecologist and complained about part of this not working correctly. And he said, we can repair that. Great. I didn't ask all the right questions. When I showed up 2 weeks later at the admissions office at the hospital, they put enough papers in front of me. I'll bet there were 5 papers that I needed to sign. Well, I wasn't going to say, excuse me, but I don't read really well, and I certainly don't read fast, and I'm concerned with some of these words. To me, it was lines and circles over sheets and sheets and sheets. and I wasn't going to reveal my sense of stupidity, so I signed everywhere they told me to sign. Never read it. And then a couple weeks later, in the follow-up office visit, the nurse said, "How are you feeling since your hysterectomy?" Now, I acted as normal as I could. Inside, my mouth fell open, and I thought to myself, how could I be so stupid as to allow somebody to take part of my body, and I didn't know it?
It's hard to hear, isn't it? Regardless of our profession and everything that we're supposed to know, we have all had an incident somewhere that we felt like that. We have either not been heard, we have signed papers that we don't read. I know I'm guilty of it. I have signed HIPAA. Ask me what it says. We all know the summary, but what does it really say? We have signed releases to other doctors' offices. Do you know what you've released? Did you know that some releases that you sign, you're not only releasing your medical records to your doctor's office, but we're just like them. But let's flip the table a little bit. Now let's put our professional hat back on. Sorry, you got to work. We all should make some type of communication material, no matter what it is. One of the things that we like to do is we like to get new research information. We like to hear about things. We do a lot of networking. Oh, my friend told me this from California. Oh, they're doing that in Wyoming. And then we want to get it out there. Well, we got to develop some effective communication material. These are a few steps. One, define the key problem area or the area of interest. So if you are not in a geriatric worker, you know that a lot of your people are not going to be interested in how to change their health after 65. Yes, there's diets that are actually geared towards that. But a lot of people are not going to care if they're still 25 and they're, superheroes and they'll never die. So, they don't want to know that. So define that. Engage your intended audience. Determine the needs, the values, the knowledge level. What's the barrier? Is there a language barrier? Do we need to get this translated in several different languages? And if we do get it translated in several different languages, which particular dialect? Determine the key concepts. If I am doing exercise and I tell you that walking is good, and you don't have to power walk. Get up and walk 5 minutes a day. Doesn't matter. 5 minutes. I need to determine what's the key concepts for that for me to get you out your chair. Design a draft. There's nothing with designing a draft and then pilot that material. Put it out there with your friends, family, neighbors. Hey, do you like this? And then let them give you feedback because everybody has an opinion these days. And we like to voice it, and revise it, and then publish it. Once you're done, make sure you evaluate it because we like to know if it actually worked. Now, in the education, the scientific, the professional arenas, we are supposed to use PMAT. PMAT is the Patient Education Materials Assessment Tool, and that is developed by experts to assess understandability and actionability. If you have a partner in this industry, and if you don't have one, get one. Everyone should have a professional partner. That is going to be your accountability partner. That is the one that if you have to develop things, you can shoot that email, shoot a copy of this, and say, do me a favor, go through it. Evaluate it and score it. Because if you can find someone that will hold you accountable, they will be truthful and honest with you because the same people you work with is generally the same people they work with. Now I want you to look at this. Can somebody tell me what this is for?
When we need help.
When who needs help?
The caregiver. I know, right?
What the caregiver need help with?
They might feel overwhelmed.
They need help to be able to get to the beach.
Exactly.
All right.
Relax. Take care of yourself.
What's this one? How do you like this one?
I like that.
That was at least better.
That's better.
All right. What about this one?
Are we going to do this?
I show you 3 very similar billboards, flyers, things that are up in hallways at local hospitals. And I could tell you for myself, this is the one I like most. The reason, because self-care is important. As a caregiver, now this is for a caregiver health literacy seminar. Did anybody get any of that?
No. Yeah. Because it's so small, you can't see it.
You can't see it. As a caregiver, I wouldn't care what you told me if you was going to feed me and take care of my loved one while I was there. When I see the beach chairs and it says self-care is important, well, yes, it is. That is, you are absolutely right. Now, this first one, don't be shy. Contact us to help support you as a caregiver. Because I see the beach chairs, number 1, who is us? And then number 2, oh, they must be talking about my travel agent. All right, we're going to do that. AAA, send me somewhere where these beach chairs are located. I wanted you to see these 3 because this is what our clients see. When you walk through a lot of offices, the other thing you see is these random pieces of paper, and they have all this print on it and then these phone numbers hanging on the bottom. Most of them are for research. But people don't see that. All they see is these phone numbers because it's so much. This is why we need the tools. Because if they don't understand, it's useless. And they're still just as illiterate as they walked in your office and they left. But how can we improve? The first thing is self-assessment. I believe these 2 self-assessments are in your book. And I forgot the reason why I want you to look at Appendix A, those 3 billboards. Those are things that are on that list that you would look for. Now, these 2 assessments, first you have the care measure and you have the communication self-assessment. The care measure is the consultation and relational empathy care measure, and it's person-centered, they both are. That one actually measures your empathy when it comes to your relationship between you as the clinician and your patient. Do you have it? I suggest everyone make copies of these, and every once in a while, check yourself. Am I doing this, or have I gotten to the burnout stage? If you gotten to the burnout stage, then you need to go on Groupon. If you need to go on Groupon, it's time to book spa days. If it's not time to book spa days, it's time to call your friends. We're going to the local bar. Margaritas everywhere. We are going to find a happy hour. If we are not a drinker, it's okay. We live in Maryland. Don't y'all have crabs and all that stuff down here? Well, Old Bay is somewhere. We're going to find it, and it's on something. We're going to do oysters. If we have to, I do believe that there is a port somewhere in Baltimore. We are going to get on a cruise ship. Even if it goes to the ocean, it turns back around and come back. So if we are not measuring up on the care, that's what we need to do. Now, our communication self-assessment, that's a big one because we communicate with everyone. We even communicate with ourselves. So if we're not communicating well with us, then we are definitely not communicating well with them. We are not communicating well with our spouses, if we have one of those. We are not communicating with our significant others, if we have some of those. We are not even communicating well with the dog. Make sure we check ourselves. This is one of my favorite people in the world. A lot of people don't know Dr. Patch Adams unless they think of Robin Williams. It says you treat a disease, you win, you lose. You treat a person, I guarantee you win, no matter the outcome. We're going to have an open forum about this conversation right here. I'm sorry, this quote. We're going to have a conversation about it because I want to hear from you. One, do you believe that this will help with health literacy? And if so, let's share with one another, how do we think that helps?